I'd like to talk for a moment about religious freedom. Our country was founded on the belief that all Americans should have the right to practice their religious beliefs as long as their faith does not infringe on the rights of others. And this concept, which is I have the freedom to stretch out my hand as far as I can, and unless I punch Hannah here in the face, I don't have the freedom to do that. That's impinging on Hannah's rights. I think that actually pertains to more than just freedom of religion, but our basic concepts of what people's rights are. And this is an idea that's woven through our Constitution and our Bill of Rights. I have the right to choose my profession, where I live, and I have the right to choose my doctor according to my own faith, but I don't have the right to choose yours. When we wrote the health reform bill, we made sure to account for this balance. The health reform law required insurance companies to cover preventive health benefits without copays. And we asked the Institute of Medicine to study which preventive health benefits should be included. And last summer, the IOM, the Institute of Medicine, recommended to the Department of Health and Human Services that contraceptives should be covered, along with cancer screening, screening for domestic violence, and many other services that have been shown to improve women's health, Madam President. A number of religious institutions objected to being required to cover contraceptive services as a preventive health benefit for their employees. President Obama heeded their concerns, and he created an exception for churches and other religious institutions. The president went even further by saying that religiously affiliated organizations won't have to pay for contraceptive coverage for their employees. I'll say that again. A religiously affiliated nonprofit employer will not have to pay for contraceptives for their employees, and that was applauded by a lot of Catholic groups, for example. But that the patients would have the right, or employees would have the right, to contraception, to exercise their religious rights. And very often contraception is used for medical preventive. I think 15% of all use of contraception is to prevent maladies that women have. I believe that all Americans should be able to freely and fully practice their religious beliefs to the extent that their practice does not infringe on the freedom of others. I believe that this freedom is at the heart of our society, of America. And I applaud the President for finding a solution that protects religious freedoms while also providing health care to nearly all women. However, my friend, Senator Blunt, with whom I'm actually working on a separate transportation amendment, has filed a non-germane amendment that goes much further than the President's accommodation of religious employers. His amendment says that any employer or health insurer could opt out of any essential benefit or preventive service required by the Affordable Care Act. All I have to do is say that their objection is on religious or moral grounds. This amendment would upend how our entire insurance system works. It would allow any employer to opt out of covering any health care service guaranteed by Americans by the Affordable Care Act. This is an unprecedented proposal, and one that could change the structure of health care in our country much for the worse. The President found a balanced approach that maintains women's access to health care while allowing religiously affiliated organizations to opt out of paying for it. On the other hand, Senator Blunt's amendment would allow employers to prohibit health plans from providing the essential health services and the preventive health services guaranteed by the Affordable Care Act. For example, under this amendment, an employer could object to covering vaccines for children. There are people in this country, I'm sure many of them are employers, who have a moral objection to vaccines. And so the plan would not be required to cover them. Or an employer could not, or the employer could choose not to allow an insurer to cover maternity care for a single woman. There are people with moral objections to people having children outside of marriage. So the woman would have to pay for her prenatal care and her maternity care out of pocket. If the employer just says, oh, no, I have a moral problem with that. And of course, Senator Blunt's amendment ignores the religious freedom of women to be able to access contraceptives. The President's accommodation a couple weeks ago protected the religious freedom of religious organizations while also protecting the religious freedom of the women who are their employees. Remember, the employees have religious freedom too. The Blunt Amendment violates the freedom of women to receive the kind of scientifically proven health care that she chooses. She chooses. Madam President, this proposal doesn't simply put women's access to birth control in the hands of their employers. It doesn't simply allow politics to get between women and their doctors. It changes the way that health care is provided in our country, and it violates a core belief in our society that our religious decisions are our own, and that each of us, every woman and man in our society, has the right to make decisions about our own health for ourselves and for our families. Over the last decade, we have seen proposal after proposal that would politicize the decisions that women make with their doctors. Now we're seeing an all-out attack on women's right to protect their health by using contraceptives. This is something that almost all women in this country use at some point in their lives. These women choose to do that. It conforms with their own beliefs about what is best for them. I think we all believe, or almost all of us believe, that women should have that right. This seems to be a clear case of one person's religious beliefs impinging on the rights of others. It is a deeply worrying case of one person's hand meeting another's face. Madam President, I rise today to urge my colleagues to fight back against these assaults. And I really urge my friends on both sides of the aisle to think about this, to respect the decisions that each woman makes about her health care, to protect each woman's religious freedom, her liberty, and to oppose Senator Blunt's amendment to undermine this basic freedom. Thank you, Madam President, and I yield the floor and would suggest the absence of a quorum.